Hi, good evening. I'm here today with Dr. Hari Krishnan. Dr. Hari Krishnan is the Assistant Professor of Cardiology at Pariyaram Medical College. And I'm explaining a free medical helpline to Dr. Hari Krishnan and getting his comments on this. Doctor, thank you very much for your time and thank you very much for agreeing to be with us and for providing us comments on our proposed free helpline. So, first of all, I'll ask Dr. Hari Krishnan to introduce himself and, uh, and then we'll go to the project.
Thanks, Raj, for this. I'm Dr. Hari Krishnan. Right now, I work as assistant professor of cardiology in a teaching hospital in Kerala, in India. Raj was just putting to me a plan of how patients could contact doctors through telephone. Most of the time, when the doctors are not right available, when they have some queries or emergencies. Now let's just listen to him as to what he has.
Okay, doctor. So, as I told you, we are planning to set up a free medical helpline in which patients can call and connect to a doctor in an emergency or when in need. Do you think such a service is relevant and will be useful for both doctors as well as patients?
Well, I think it's a good service to be provided to patients because they might feel secure because at any given point of time they have a medical contact. And for doctors also probably, they can give the same number to their own patients instead of giving the personal numbers.
Okay, so you're saying, okay, instead of giving your personal numbers, it will be an advantage. Doctors can receive calls on their mobile phones without giving out their personal
One
numbers.
more advantage is like if at that moment of time, me as a doctor is not able to give the service to the patient, the call may be diverted to somebody else, and so the patient is taken care
of. Okay, so the patient gets the help he requires at that point of time. So
even if it's not straight away from me,
okay, from somebody
from
else.
some other competent person.
So, what do you think? Do you think patients will be comfortable with this telephonic conversation? Do patients call you now? Do you have a medical conversation with patients over the phone at this moment? As of now?
Yes.
You have it. So
yeah, we have.
You do talk to patients of their medical issues once in a way when they have an emergency, when they are out.
Yeah, now mobile phones have become very common and popular that it's difficult to restrict our personal numbers.
Okay.
The hospital where I work right now has got the policy of providing the contact numbers of doctors.
Okay. Now, another question, see, though we plan to start this as a free service, over a period of time, we plan to charge patients who use the service very often, and so at that point of time, do you think that doctors will be comfortable to pay and join the service, or do you have a comment on that?
As you said initially, probably I think since it's a novel concept in this country, you may have to do it for free. But later, for the service not to get overexploited or rather used for inappropriate situations, very often which is not required, and maybe for restriction, levying a charge will be.
And do you think you will have, see, most of the doctors here in India are very busy, very busy. They have lots of patients, they have to attend operations, they have lots of other things to do. So, do you think such a service will be a distraction for them and they won't have time to answer calls from patients? So, will this become a negative thing because when a patient calls and the doctor does not pick up the call? So, do you think that?
Yeah, that's what I said. Once the service is well set, and if things are going fine, it becomes beneficial for the patients as well as extra work for the doctors. At that point of time, probably you could pay the doctor and take a charge from the patient as well.
Okay. And see, at this moment, we have not added video conferencing to our service. So, will having a video or will having a video conference with the patient who's calling you help you in your diagnosis? Do you think you can see the patient and that will help you in giving a better diagnosis?
Probably in the second stage. What I feel is not for all patients.
Okay.
Once you start the conversation and later if it's required, there can be an add-on.
Okay. And two other questions before I would like to conclude this. One is, do you think such a service can be a good marketing and advertising tool for participating doctors as well as participating hospitals? Will such a service help to attract patients?
Yeah, if you're able to kind of the calls if are diverted to the doctors in the same locality from where the patient is calling, probably that will increase the reputation of doctor in that locality. So
Okay.
if you're able to handpick and divert the calls
Okay.
to the
Okay.
exact locality from where patients are calling,
Okay.
the doctor of course
Gets
more
benefited,
familiar with the patients around.
more familiar with the patients around, and so it'll be good for the hospital. And do you think there are some challenges we will face in implementing this service? Do you think this is something, or do you have any concerns about such a service, whether it can be misused or it can be? Do you have any concerns about such a service?
I think the only difficulty would be to, because the people and the doctors as well as the patients as of now is not very familiar with this concept. Probably to get it established would be slightly difficult.
Difficult.
But what I feel is once you get it done, people find it useful. The doctor also finds it, I mean, is able to keep the patient secure out of this. I mean, he is able to give a security feeling for the patient. He gets some money out of it. So, like all the ways, doctor also feels comfortable. Once things reach that stage, then I mean, it may take some time.
Sometime. So you're saying it should be a win-win situation for all, for patients, for doctors,
Yeah.
for us as organizers of this service,
Exactly.
for all participants.
Yeah.
It should be.
I
a
think
win-win situation.
it will take some time to
Okay.
get the things set right.
Okay.
But once it's done, it should be fine.
Okay. So we'd like to have your suggestions, your comments, and your active participation in making this service a great success.
Definitely.
And so thank you very much, and thank you a lot for joining us. Thank you very much. Bye.